Oh, my face is over my name. So what we're doing here is, I think I might be right in saying it's a world record. We are simultaneously casting to Instagram, Facebook, and YouTube. I don't know if anyone's done that before. I'll have to check with the record books. But this is what happens when you're a social media influencer. The platforms just are crying out for this sort of content. So what can I do? I can't say no. So good evening. I've got a good lot of questions this week. I tell you what, good lot of questions this week, but don't let that put you off. If you've got a question, chip in and ask away, because you can never have too many questions. Never have too many questions. I'm hoping it's all working okay. Can I assume that? Can we assume it's all working okay? Is it? Oh God, should I check that? I mean, I know yeah, it's all working, isn't it? 2 on 2. Can you hear me? Can you hear me all right? Yes. Okay. Instagram. Can you hear me? Can you hear me all right? Can you hear? Is the audio working on Facebook? Is anyone on Facebook? Is it on Facebook? No, no one's on Facebook. Okay. Anyway, people are on Instagram, and that's what counts. Listen, guys, I've got a big following on Facebook, so they will be there in a minute. Okay. So it's not a problem. It happens to all of us. Speak to anyone, any social media influencer, it happens to us all that there are times when we are speaking to an empty camera. And what the professional does is he just rolls with it. He pushes on. He pretends that there is someone interested out there. But Instagram there is definitely people there because we've got comments. So I don't think there can be any doubt that I've got a loyal following on Instagram. Thank God, because I only just started doing it on Instagram. Can you imagine? Can you imagine I was just doing what's on Facebook? I've been there. I've done it. I'm not too proud to say I have, because the thing is, it comes as a replay. So maybe I better not be saying this stuff, because if you're watching on replay, you might think I'm popular. So yes. Hi, everyone on Facebook. Good to see you all here tonight. So let's get on with it. Let's get some questions going on. First question we got here tonight, people, is, can I have a breast reduction and implants carried out under one surgery? Do you think? Oh, all right. Are there fors and against doing one surgery? Can I have a breast reduction and implants carried out under one surgery? What kind of question is that? Who asked that question? You sort of can, and I do sometimes dabble in this with people. I sometimes dabble in this concept of a breast reduction, and I'll get the annoying bit off the screen on Facebook, but not that there's anyone there to be annoyed by it. But anyway, so yes, can I have a breast reduction and implants carried out under one surgery? Are there fors and against? Yeah, sometimes I do dabble with this concept of having implants and reduction. The bottom line is, I don't think it is I don't like the concept of it. And I know I've heard people speak at meetings and say that it's good, plus minus technique or something they call it. But basically, the way I go, simple way I look at it. I say, if you've got a problem with your shape, it's a lift. If you've got a problem with the size, it's implants, assuming they're too small. If they're too big, it's a reduction. So implants make the breast bigger. A lift is the way to make the shape better. So if this person is saying, I want to have a breast reduction and implants, then they're saying, obviously, they want to have the breast smaller. So I would say just have a breast reduction. Now, what some people think, and something you have to be clear on if you're having a breast reduction, is the breasts are reduced, the breasts are lifted, but the shape is always up there to start with, and then it settles. It settles, so it's not quite as full as when you first had it. To what I always say is a natural shape. a natural breast isn't like that. A natural breast naturally has a bit of a flow in the upper pole, a bit of a sort of concavity in the upper pole, and that's what happens when you have a breast reduction. Now, some people say, I want to have it fuller up there, and they say, that I've done something wrong on Facebook. I think I've done something wrong. Have I done the thing? Oh, what have I done? I think I haven't filled it in properly. Carry on, Jake. Carry on. Okay, I'm carrying on. Breast. Say that. So some people will say, I don't like the shape. I don't want it to be a bit shallow in the upper pole. I want to have more fullness in the upper pole. And so if they say that, then that's talking about using implants. If they say that, implants give a more fullness in the upper pole. But I would say, don't have implants just to have the fullness in the upper pole. I would say if it's primarily the size, there's a problem in that they're too big, just have a reduction. Because if you have implants, they'll be bigger by definition. Obviously, if you have implants, they'll be bigger, and you want them smaller. So if you want them smaller, what do you do then? Well, what people do and what can be done is you can over reduce them, so you can make them smaller than what you want them to be, and then put an implant in to give you the shape. But I don't like the thought of that personally. So I don't like the thought of taking what breast volume out and replacing it with implants. So it's not really something that I do, but it can be done. So I guess the purpose of this Q&A is to talk about in general terms. So in general terms, yes, it can be done. You can have a breast reduction at implants. Personally, I don't do it, but it's not all about me, is it? So yeah. So it can be done under one surgery. Fors and against doing this as one surgery. Well, I mean, I would do it in one surgery, because if you're going to stage it, what you're going to do, if you're going to do the breast reduction, if you do implants later, you will be bigger. So you want to do it in one stage, because you'd over reduce it and then replace the volume that you've over reduced it by with an implant to give you the shape. If you staged it, how are you going to stage it? If you do implants to start off with, for someone who wants a breast reduction, you look ridiculous. If you've got big breasts, then you put an implant in, that's going to look ridiculous. If you do the breast reduction first, you're going to have to over reduce it and make the breasts a lot smaller than you want them. I suppose you could do that. You could over reduce it and then put an implant in. Could do that, I guess. But I mean, the point of doing that would be to see if you're happy with the shape, but you'd have to over reduce the size. Because if you reduced it to the size you want to be and see if you're happy with the shape, and you say, no, I'm not happy with the shape, okay, I'll put implants in, you'd have to do another reduction. I don't know if anyone's following this. It's all clear in my head, but anyway, it's a bit of a niche thing, really, isn't it? Anything to say? Anyone on Facebook? Anyone? Anything to say? No? Okay, that's fine. Maisie Mayloose. Do you do thigh lifts? Are you doing face-to-face consultations? And when are ops starting? Or, whoa, Maisie Mayloose, you've covered about half the questions I've got tonight. So well done, you. Do you do thigh lifts? Yes, I do thigh lifts. Two ways of doing thigh lifts: one with a groin crease, one with a medial thigh, a groin crease incision, one with a medial thigh incision. I pretty much always do the medial thigh incision. Much bigger incision, much better lift. I don't like the one that's up in the groin, personally, personal preference. Again, for the purposes of this Q&A, I think I should say what's possible. So the groin crease one is possible. I just can't get a very good result with it. Are you doing face-to-face consultations? Yes, I am. Did some yesterday, doing some tomorrow. I was at home today doing virtual consultations. Loved it, love it being at home. Fabulous. But I've got to go in tomorrow. Love it, be going in as well, obviously. Obvs. So yeah, we're doing face-to-face consultations at the clinic, and we are doing ops at the clinic, which means local anaesthetic procedures. But we are not doing bigger procedures like breast implants, tummy tucks, breast reductions, stuff like that, because that needs either general anaesthetic or local anaesthetic with sedation. And so those we are not doing at the moment, because all the private hospitals that I normally work at are being used by the NHS. And so we can't get in. So we are looking for places to do our surgery, because we've got lots of surgery to do. So we haven't found anywhere, but we are looking at maybe, where are we now? August. Hopefully we will get something sorted out. Hopefully. And it might be local anesthetics and sedation in the first instance before general, but certainly there's quite a lot of things you can do under local anesthetic with sedation. So those cases might be done first, and then moving on to general anesthetic. 5 times thumbs up. Need my thighs done last part of my journey. Thighs would probably be a GA, really, Maisie. So probably something we'll be doing at the hospital, but definitely something to be done. And well done on your journey. And thank you for the question. I mean, I know. I mean, all jokes aside, I know I've not got a huge following on Facebook, but you'd think there'd be someone there, wouldn't you? I mean, I know I was late, but people have turned up to Instagram. Hello, hello. I mean, I have turned it on, obviously, haven't I? 3, what's that? Anyway, I'm gonna, you know, it's fine. It's fine. It's not a problem. We don't need them. We don't need you guys, okay? We don't need you because we've got Instagram. All right? It's YouTube as well. Maybe it doesn't show numbers because it's Facebook. Oh God, I keep on pressing. It's fine. I'm gonna push on. Yeah. Whatever. Whatever. So, Maisie, I'm on the south coast, but would like to travel to you. Would that cause an issue? Facebook's working, was it? Okay. Well, that makes me feel worse, Maisie. Well, well, that's fine then. I'm just a professional, and I'm just going to push through this. Facebook is working, is it? That's actually worse. Anyway, but Maisie, you want to come from the south coast to see this influencer in the flesh? Don't blame you at all. It wouldn't. Well, it does cause a bit of an issue, Maisie, because if you travel a long way, you know, you have to come for a consultation. Well, we can do virtual ones, so we do virtual ones in the first instance, but you'd have to come to the clinic at some point. And you know, it's difficult if you're traveling a long way. And then if you have the surgery, then dressing's usually a week later. And then if everything's fine, I guess it's fine because we do it all virtual. We can do consultations and things. But if there's a bit of wound healing problems, if you get a bit of infection, well, still, I guess we can, you know, organize antibiotics virtually. But if you have a bit of a dog ear, a little bit of a bump, or it just does make it a little bit more difficult. So to be honest with you, Maisie, my advice is always to look for someone local if you can. That is my advice. And I'm sure there's lots of very good surgeons down on the south coast. They would probably be based in sort of Tunbridge Wells, Mark Pacifico, someone like that. And you know, that sort of area. But I'd be very happy to see you, Maisie. But yeah, that's caused a bit of an issue coming. So Facebook's working. It's just there's no one there. That's okay. That's fine. I'm cool with that. I'm cool with that, man. No problem. Some days you have people, some days you don't. You know, it's take the knocks. I mean, I was late, my fault, I guess. So they were all here at 7. That's the thing. Everyone, all my followers were there at 7, and now it's 7:30. Then they've all gone for dinner. Right. Next question, please. When are you not able? Sorry, why are you not able to carry out operations in hospital? So this is an interesting thing. Operations are being carried out in hospital. So if someone wants a breast reduction, a tummy tuck, a thigh lift, that is possibly possible to be done at a hospital. You can do those operations at hospitals. But the problem I've got is all the hospitals I work at are taken over by the NHS. And I was talking to one of the hospital managers today who was saying, maybe, and I've spoken to friends got a friend down in Wales, got a friend in Scotland, who are saying that there are some hospitals which haven't been fully taken over by the NHS, which are able to do surgery. So surgery is being done in hospitals, but the hospitals I work at have all been taken over by the NHS 9 to 5, Monday to Friday. So they are doing private work after those hours, but it appears they are sort of prioritizing other cases. They're not prioritizing plastic surgery. And I think one of the other problems is that, probably quite rightly, if they've got a surgeon in there doing the NHS work in the daytime, they're letting that surgeon do the evening. I don't know if that's the case. I just heard that once, whether they're doing that routinely, but it would make sense if there's a surgeon doing the day, then rather than changing surgeons with all the, get your new person in, they let the same person do his private work in the evening. Now, problem is I haven't got any NHS work to do, so I'm never there in the day. So I'm at a bit of a disadvantage in that case, and so I'm not able to carry out operations in the hospitals because I haven't got any dates, and we're desperate to get some dates. And I'm looking into hopefully getting some dates in the next few weeks. I'm hoping, but I still haven't got any dates because the hospitals are all doing NHS work, and the hope is. And the problem is we don't know how it's going to pan out. The hope is that the NHS will start doing elective work in the hospitals again. So once the NHS start doing work in the hospitals, then the private hospitals can do private work. So I've got to be honest with you. Instagram. I'm so happy that Instagram is active. I've only been doing it on Instagram a few weeks, and look at this. This is brilliant. So Facebook was working. You waved. Oh no. Sorry for questions. Do you do lipo as well as during thigh lift, as some surgeons don't? Yes, I would assess it, Maisie, but I don't routinely. I don't routinely do lipo. Often, what happened, the people during a thigh lift, when you need a thigh lift, often the weight has been lost, the weight has gone, and so you just excise the skin, a bit like a tummy tuck. You excise that skin and fat. But I do know that there is some surgeons who will do a lot of extensive lipo and then literally just excise the skin because the lipo would have taken the fat out. Don't see the benefit of that, but maybe bleeding. There probably is benefits. Maybe less bleeding. I'm not sure, but I don't do that. I just cut out the fat in the same way you do a tummy tuck and cut out the fat. Now, but in the same way, the tummy tuck, sometimes you can do lipo to other areas, to contour other areas. So the tummy classically is the hips and the flanks, which you can do lipo to contour those areas. And similarly, if there's some problems maybe around the knee or something like that, you could combine liposuction with a thigh lift. Is there other areas that aren't going to be included in the thigh lift? Then you could have liposuction combined with it. But as I say, I don't liposuction is not a routine part of thigh lift for me. It's just because often the fat has gone and it's just skin that you're removing. Is there an average cost of a breast reduction? Probably not, Leonie. Depends what you're talking about. If you're talking about overseas and UK, it probably varies widely. We have a cost. There is a cost of a breast reduction. We can certainly send you information on that. I don't even know what it is. I don't know. Do you want to know what the cost of a breast reduction is? Sorry, I'll get the price list up. I'll get the price list. I'll tell you what the cost of a breast reduction is in a minute. But yeah, it probably varies widely across the country. So we got two prices. Anyway, I'll just say it starts at so call it 7,000. Starts at 7,000. A breast reduction does, by the looks of it. I don't know if I should do that. I don't know if that's the right price. Anyway, that's what I've got there. 6,985, not 7,000. 6,985. All right, starts with a 6. Get it in there, but yeah, that's where it starts at. Dan 9Q9, will you get scarring after a shave excision? Yes, you will, Dan. And a lot of people will say, I had a mole removed and it left no scar and it's disappeared. First of all, the face scar as well, and often moles. I'm assuming you're talking about a mole, and often moles are on the face, and often scarring is so heals so well it's hard to see. But strictly speaking, there is a scar there. There will be a scar there. So you'll get scarring out whether you have a shave excision, whether you have a formal excision, whether you have cautery, curettage, whatever method, laser, whatever method you have it removed, there will be a scar. It's just it often heals so well you can't see it. But strictly speaking, there'll still be a scar, but it's, yeah. So people say there was no scar. Plastic surgeons, they don't leave scars. Now we do leave scars, but we try and minimize the scarring and put them in places where they hide and they settle well. Leonie, is there any advice that you would give to someone just looking for a surgeon? I am in Scotland, so think I may be too far from yourself. Yes, you may be too far, Leonie. So what you're looking for is, if a plastic surgeon you're talking about, it's FRCS Plast is what you're looking for. Leonie, you can. Glad you asked for that question. Yeah. Is that reversed? It's the right way around on Facebook. Yeah. This guy here has written a book, an FRCS Plast. Where is it? Yeah. There. FRCS Plast. That means they're a plastic surgeon. Bloody good book, by the way. Good read. Yeah. NHS consultant, someone who is or has been an NHS consultant. So Tamir Shoab has got a clinic called Labelle Form, and he's just opened a new facility up there. So he's in Glasgow, I think. So he's a good guy up in Scotland. So yeah, there'll be plenty of good guys up in Scotland. There's a very good plastic surgery unit in Scotland, in Cannisburn, very well respected. So there's lots of very well respected good plastic surgeons in Scotland. So that's my advice, Leonie. Look for a fully trained plastic surgeon, someone who is or has been an NHS consultant. Look for FRCS Plast after their name. Have a chat with them, see if you get on with them. Look at some before and after photos, and take it from there. Need any help? Call me. Yeah, message me. Whatever. Can you have an FDL after tummy tuck? Yes. Hold on. Well, can you have an FDL? Well, no. Sorry, I retract that further up. That previous answer. No, I'm going to say now. I mean, you can have the vertical bit of it, but it's like, can I have a tummy tuck after a tummy tuck? You can't really have a tummy tuck after a tummy tuck. Having said that, I saw someone the other day who I am doing a tummy tuck on after she's had a tummy tuck, but she's had a really weird tummy tuck. It looks like she hasn't had a proper full tummy tuck. So, you can just do the vertical bit and take that vertical excess out, but you probably wouldn't be able to do the full fleur-de-lis. Let me think about this, because you're cutting around the belly button. I mean, you could, yeah. I mean, so you couldn't do another full tummy tuck, but if you've had a tummy tuck and you want a fleur-de-lis, you could do a limited fleur-de-lis, I guess, because I'm guessing if you've had a tummy tuck, you're not going to have a massive amount of sort of horizontal excess. It's mainly the vertical excess that you want to get tightened, isn't it? But you could do a little localized one because you're cutting around the belly button anyway. So yes, you could. Whoa, can we edit that out? So yes, you can have a fleur-de-lis after a tummy tuck. Yeah. Yeah. Simple answer. What's the problem? That's the answer. Yes. I got your message. I'll send you pictures to your email tonight. You got my message. Send me pictures, Laureen. Looking forward to it. Maisie. I had a 360 TT with no lipo and now been left with fatty areas. That's why I asked. You were asking about thigh lift, weren't you? So I think, what is going on? It's all coming off on the chat in Facebook. What's happened? Was it working in Facebook? So Maisie, you had a 360 with no lipo. I wouldn't do a lipo with a 360, Maisie. Tummy tuck. I wouldn't do a lipo with a tummy. Sorry, a lipo. What am I saying? I wouldn't do lipo with a 360, and I wouldn't do lipo with the thigh either. But and you'd be left with fatty areas. So yeah, with a 360, you don't tend to need to do. Where's your fatty areas? Upper abdomen, is it? Hmm. Yeah. Well, you could have lipo with a tummy with a thigh lift. What's the price of thighs, please? Okay, got the price list up, Maisie. I shouldn't do this. I shouldn't have done this because I'm going to get told off. I hope I got the right price lift up. Thigh lift. Thigh lift. Maisie, I can do you a thigh lift tonight only. Special offer. No, this is the price. 6199. How's that sound? Less than 6,200. We do a thigh lift. We do a special offer. Is that right? Yeah. £6,199. I mean, that's a steal. Absolute steal. What does it take a while for the scar to heal after the shave excision? Not that long, Dan. No. It's a bit red. It's like a scab, basically. So healed in a few days, 4 days, it should be healed, but it'll be like a red mark. And it takes a few months for it to settle, for everyone to settle, for everything to settle and soften. So it does take a few months for it to settle, but to heal, just a few days, Dan. Just a few days. Kim, sorry, everyone should get the book. What book? This book here, you mean? Thank you, Kim. Everyone should get, particularly since I give it away. If you come into the clinic, I'll give you one. If you send me, if you want me to post it, I'll post it. $3.95 postage and packaging. Right? Don't have to pay for the book. Yeah, you get it on Amazon, $12.99, my friend. Yeah. Now, if that's not a bargain, I don't know what is. Thank you. I'm not far from Glasgow. Look at Tamir. He's a good guy. I don't know what's going on in Facebook. I don't know what. Are they the same questions? Wow, I don't know what's going on. Wow. I'll have a look at Facebook questions. I'm really sorry, Facebook. I thought you weren't there and I thought there was no questions, but there are questions there now. But anyway, hold on a minute. What's going on? I had a tummy tuck 12 months ago and I've got wobble after tummy tuck. Lauren, were you asking about the fleur-de-lis? Laura, I think. Were you? Anyway, yeah, that's no good, is it? Wobble. The problem is that the problem. So, Laureen, if I can just try and, in defence of your surgeon, well, I don't think it was me, especially if it was me, but if whoever it was, in their defence, and I know this doesn't help you because you've paid a lot of money for a tummy tuck, but when you're doing a tummy tuck, you are trying to make it as tight as you possibly can. We make it really tight. We break the table. We make it really tight, but we don't want to make it so tight that you get wound healing problems. Because if you make it really tight, then it opens up. So we've got to get the balance. If you make it too tight, you get wound healing problems. But if you don't make it tight enough, you get the wobble. And the problem is also the fact that you need a tummy tuck means that your skin has been stretched by something or someone. So you've either had children or you've lost weight, usually. Pretty much always, I would say. Something has stretched your skin and that has damaged your skin. And so your skin has lost some of its elasticity, so it hasn't recoiled back. And so that skin will still be the same skin that's left after the tummy tuck. So, I don't know how bad your wobble is, Laureen, and I'm really sorry to hear it because I know that if you have a tummy tuck, you don't want a wobble. You don't spend all that money to have a wobble. But on the flip side of that, it probably healed well because it wasn't under enough tension. So you might think it wasn't under, I wish it was under more tension because I want it tighter, but at the same time, it healed well. So it's difficult. Maisie sent me a message. Thank you, Maisie. I look forward to looking at that. Double thumbs up. I'd stay up there to make it easier. Are you talking about Glasgow? Yeah, I think. I posted in Facebook and then Insta. Sorry. I was getting nothing on Facebook, but stuff's all come up in Facebook now. So I think it's the same question. Is there an average cost for a breast reduction? Can you have an? We've had that. Here we go, Emma. I'm really sorry, Emma, if I missed your question. It's not me. There was nothing going on Facebook. So sorry about that. So Emma, I will be No, to have you do my surgery. I'd stay up there to make it easier. Oh, stay here. You'd come here to have the surgery and stay here. Yeah. Sorry, Maisie. Are you in Glasgow? Was it you or Loreen? Who's in Glasgow? You'd be welcome to. I'm losing it a bit. But you'd be welcome to come, Maisie, and stay here. Or, as I say, there are good people up in Scotland. Were you in Scotland? Where were you? Anyway, there are good people all over the country. Oh, you're South Coast. Sorry. Who is someone? So South Coast. I mean, you got London. You got London. So Leonie's Glasgow. Right. Sorry. So Maisie, you got good people in. So oh, that's right. Tunbridge Wells. Mark Pacifico, good guy. Mark Pacifico's a good guy, and loads of people in London. Stuart James, my good friend Stuart James at the Marsden. Paul Harris, living legend that is Paul Harris in London. They're all closer than me, and arguably better surgeons than me, because London, they're all good in London, aren't they? Previous surgery was in London. Okay, is that good or bad? Is that the wobbly one? Sorry, are you wobbly, Maisie, or who's still wobbly? No, Lorraine's wobbly. Right. Okay. Oh, right. I need a chart. I need a flow. I need a whiteboard with a chart to keep track. So anyway, I'd be happy to see you, Maisie. I'd be happy to see you. But at the same time, there are good people in London and Kent and other places in the UK. Oh, how's it going for you? Is this going well? Do you think is this all right? Or oh god, I get all blurred out. Right. Hi, Facebook. Good evening. Nice of you to be here. If you've been here all along, I do apologise. I have. Emma, I'll be attending Mummy Makeover consultation for surgery next year. I know this will be discussed at consultation. However, I'm eager. What differentiates a mini to a standard? Good question, Emma. Good question. Love it. So, Emma, people in general want less mini tummy tuck, mini facelift, mini breast lift, mini arm lift, mini. And as a rule, the mini ones are less price, less scarring, less complications, less downtime. What's not to like, right? So that's the same for mini tummy tuck. So a full tummy tuck has a big long scar from hip to hip. A mini tummy tuck has a much shorter scar, and it's probably a bit, if you've got a cesarean scar, it's a bit longer than the cesarean scar in the same sort of place as a cesarean scar. Full tummy tuck has a scar around the belly button. Mini tummy tuck doesn't have a scar around the belly button. So mini tummy tuck is less scarring, less price, less downtime, less complications, but less of a result. That's the problem. Less scarring means less skin gets removed. Same with the mini facelift, same with the mini breast lift. The less scarring, everyone wants less scarring. I want less. I want to give you less scarring because I don't want you to have wound healing problems. If I can do something and give you as good a result with less scarring, I mean, the other end of the spectrum is these non-surgical treatments. That's no scarring. It's even better. No scarring, no complications. Fantastic. I'd be doing them all day long if I could get as good a result. And that's the problem. It's less of a result. So it's a shorter scar on the lower abdomen, and it's no scar around the belly button. But the belly button gets pulled down a little bit because you are taking a bit of the skin, but you're just really addressing the skin from your pubic area to your belly button. So if you've got a bulge above, if you've got often people have got a cesarean scar, which is a bit tethered, causing a bulge above it. So if you've got that pouch, that bulge above your pubic area, a mini tummy tuck's really good at getting rid of that. It doesn't do anything above the belly button. You can't pull through above the belly button because you're leaving the belly button in place. You can't repair the muscles, the rectus muscles. You can't really bring them together because you can't get up there, and you don't do anything to the sides. You can do some liposuction to the hips, but it doesn't contour the whole abdomen. It just contours the central abdomen between the belly button and the pubic area. So that's, yeah, good question, Emma. Thank you for that. And if you're coming to see me, I'm looking forward to seeing you. Tulip Medical says that I am a great plastic surgeon. So I'd like you to all take note of that. And that's coming from Tulip Medicals. Thank you, Tulip Medicals. That's very kind of you to say. And I'm very grateful for that. On Facebook, Khan says there's 12 of us on. I don't know when you said that, Khan, but I don't know. Oh, look, you're on the picture as well. Oh, hello, everyone. So I don't know. I don't know what was going on, Khan. I'm sorry. Lisa, are you doing thigh lifts? God, that was ages ago. Hello, Khan. Sorry, Maisie. When a previous surgeon has caused you to lose a nipple and then tried to reconstruction but failed, it's time to find another surgeon. Wow. Any recommendations for nipple construction? So nipple construction, Maisie, uh, that's pretty bad, Maisie. Yeah, that's a pretty significant complication you've had there. So I'm very sorry to hear that. But nipple reconstruction would be a breast reconstruction surgeon. So you want to find a surgeon whose special interest, and again, talk about this in my book. So in plastic surgery, there's different. So any plastic surgeon in the NHS will have a subspecialty. So when we train as plastic surgeons, we start off as general, just as you train as a surgeon, just doing appendectomies and bits and bobs, and then you specialize in plastic surgery. And then when towards the end of your plastic surgery, you specialize in subspecialties such as burns. So these are the subspecialties: burns, hands, cleft and craniofacial, skin, breast. Have I said breast? Head and neck. Some people do lower limb, but it's not really a specialty in itself, lower limb. Not many people are pure lower limb. So those are the specialties of plastic surgery. So when you work in the NHS, you will do just that. So if you're a head and neck surgeon, you just do head and neck surgery. If you are a burn surgeon, you just do burn surgery. And if you're a breast surgeon, you do breast reconstruction. So if someone comes in and needs a breast reconstruction, the burn surgeon wouldn't do it. The breast guy would do it. If someone comes in with a burn, the head and neck guy wouldn't do it, so etc. But the problem is in the private sector, it's a bit like, people who everyone does a bit of everything, basically. So if you need a special, and to be honest, it's probably fine for most breast surgery. Most plastic surgeons are trained to do most cosmetic breast surgery. But if you have a problem and you have a difficult case, maybe an asymmetry or maybe something like this, nipple reconstruction, which is a challenge, it's a real challenge, Maisie. Nipple reconstruction in a previously lost nipple, so that's a scarred area. To reconstruct the nipple is a challenge, no question about it. And probably my first line would be tattooing, I would say, Maisie, rather than actually going into surgery, because you're raising skin flaps, you're trying to raise up and build a nipple on a bed of scar, which is very difficult. And you'd want to wait at least a year until everything's healed before starting going down that road. But yeah, what you'd look for is a plastic surgeon who specializes in breast reconstruction, probably who's got an NHS job in breast reconstruction. And those surgeons I mentioned, Stuart James, is a good friend of mine, and he works at the Marsden, and he's a breast reconstruction surgeon. And I am sure, would be happy to treat you, as would Paul Harris. They both work at the Marsden. I think, has Paul left them? I'm not sure if he's left. He might be full-time private, but I'm sure they would both be very happy to help and to help you with that. And they're very used to operating on difficult cases, on challenging cases, on revision cases. So they would probably be, up there with the people in the country who could help you out with that, Maisie. Maisie, were you in? Yes, you were in South Coast. Yeah, you're not Glasgow, right? Okay. Need a proper chat via virtual. Yes, Maisie, let's do the proper chat. You can do it online. You can book it, Maisie. You can give us a ring. You can give us an email. What does a nipple graft mean? It's been suggested on the expert surgery group that when having a reduction, I may need one. So if you've got a significant, if you've got a very large breast, so it's for a massive breast reduction, really. So if your breast is very large, then when you do a breast reduction, you're moving the nipple from where it is now, which is usually too low, to a high place. And to do that, you have to keep it alive. You have to keep enough blood supply and nerve supply going to the nipple on what we call a pedicle. And the longer the pedicle, the more risk that the blood isn't going to get all the way to the end of that pedicle and the nipple will die. And if you're worried that that is going to be very long, that pedicle, so really for a massive breast reduction, you might worry about that. What you can do is you can literally take the nipple off and put it back on as what's called a free nipple graft. And I think a lot of people think that all breast reductions and all lifts are done like that way, but they're not. It's only for a really, well, in my hands anyway, for a massive breast reduction. I don't do it routinely, it would only be for a massive breast reduction. When you think that pedicle is going to be too long, the blood's not going to get down that to the end. So you take the nipple off and you put it on as a free nipple graft. So it's the same as a skin graft. If you have a burn or something on skin, you can take a bit of skin off your thigh and put it on your hand or whatever. You actually take the nipple off and thin it out and put it on as a oh, Maisie's off. Oh, right. See you, Maisie. Thanks for coming. Yeah. See you soon. Yeah. So yeah. So it's the same as a skin graft, and you take the nipple off, you thin it out, and then you put it on as a skin graft. And you put like a bolster dressing on with a bit of pressure. The problem with a nipple graft is that the nipple often lacks projection, so the nipple, the bit in the middle, doesn't stick out very much. You can get problems with the pigmentation of the skin, so the areola might be depigmented, so it might not be a uniform color, and you'll always have problems with the sensation. You'll never have normal sensation. Now, admittedly, having a breast reduction on a pedicle, you might have altered sensation, but with a free nipple graft, you will always have abnormal sensation. But that might not be a big problem for you if you've got very large breasts and just want to get the volume out. And it can certainly allow you to make a bigger reduction because you don't have to worry about the pedicle. So that's a free nipple graft, Leonie. Here we go. Facebook's cranking up now. Maisie's off. Take it easy, Maisie. Helen, best way to fix a mild capsular contracture, not visual to look at but can feel it. Breast org, and is likely to happen again. Thank Helen. Helen, easy one. This, do nothing. I'm serious. Best way to treat a mild capsular contracture, do nothing. Capsular contracture is scar tissue that's forming around the implant, and it's progressive. It gets worse. But if someone comes to see me with a mild capsular contracture, I will suggest that they don't do anything and they leave it, and it'll probably get worse. But it might take many years for it to get worse. And if it gets worse, then you can have something done. But I would leave it as long as possible, because if you have something done now, then you can have new implants put in, but the capsule will start happening on the new implants. So really, with a mild capsular contracture, what you're describing is a grade 2 capsular contracture, something you can just feel a bit of hardness, but you can't see anything. We would tend not to operate on a grade 2. You really want to wait to grade 3, grade 4. Grade 3 when you start to see it, grade 4 when it gets uncomfortable. So I wouldn't recommend operating on a grade 2. And I don't know of anything that will help it. I wish I did, some tablet or something like that. I don't know of anything that'll help the that not get worse. So yeah, just positive thinking and just accept it, really. And it just happens to implants that they do tend to get scar tissue forming around them. So Jay, I couldn't do surgery on anyone. Fair play to you. Had ultrasound once and made me feel dizzy when I saw my insides on the screen. You know what, Jay? I think it's a bit different when you're doing it to other people. I think if I saw something on myself, I think I'd probably be a bit queasy as well. But I think it's a bit easier when you do it to other people. And the other thing about doing surgery is it's all sterile, prep, draped, squared, all when you see these things like police interceptors or whatever on TV, the ambulance things. I'm not sure if I could do that. Something what the ambulance do. They come to a car accident and there's sort of bits of clothing and dirt on the road and someone's in pain and like, oh my God, I don't know if I'd be very good at that, to be honest with you. I think we got it easy when you do surgery because it's all like, I think it's a bit easier. But anyway, each his own, Jay. Each his own. You don't have to do it. Olivia's here. Olivia's a bit late tonight. Well, I've got to be honest, Olivia, I was a bit late myself tonight. Olivia's got 2 questions. How much worse is the recovery with extended tummy tuck compared to a standard? So that's question 1. Well, as I said, Olivia, it depends what you mean by an extended tummy tuck, really, Olivia. And I think you probably have to speak to the person who's talking about an extended tummy tuck. I mean, are they going round the back? Are they nearly going to meet in the middle? I mean, it's going to be a longer scar, so therefore, more to heal. But if you think about it, each bit of scar is going to take the same amount of time to heal. So I wouldn't have thought it'd be significantly longer, maybe a day or 2, but it's not really something that I do. I don't really go significantly round the back. I do a 360 or just a tummy tuck where I just go to the hips and flanks. So I guess, yeah. Sorry, Olivia, I'm not sure. After a tummy tuck, why do you have to be bent over? How long is it for? Are you allowed to stand straight? Good question. Good question. So yes, what we do is we break the table when we do a tummy tuck, and in order to get it as tight as we possibly can, because we know that skin is going to give. And a lot of people say to me, when can I start walking straight? Well, you can walk straight whenever you can, and sometimes people can walk straight after a few days. Phone. Sorry, and some people it takes a week or two. So you're bent over because we want to make it absolutely as tight as we can because we know it's going to give a bit. And so I would normally say a week or two is normal. You come back for your dressings after a week and you're probably still a bit bent over. So are you allowed to stand up straight? Well, you're going to put tension on the wound, so it's going to hurt. Even if we said you could stand up straight, you're not going to want to stand up straight because it's going to be really painful. So you're naturally going to bend over. And then people say, when can I? It's just when you feel up to it. Your body will tell you. I think it's a bit further back, not fully around the back. Yeah, I think it is. I think that's what an extended is, but it's, yeah. So I wouldn't have thought it'd be that much longer, the recovery, to be honest, Olivia. No, pretty similar, I'd have thought. Gastric, fantastic. I watched a documentary and they started slicing a human liver. Oh, I ran to the kitchen and was sick. Gross. Yeah. You've got to watch what probably shouldn't have put that one on. Gastric. Flipping heck. Slicing a human liver. Dear, oh dear. Right. Where am I up to? Breast reduction, and I've done that one, haven't I? Why? I've done that one. Or on this one. If I have a mummy makeover, is it carried out in one go? What is the healing time? Yeah, I mean, by definition, a mummy makeover is one go. Otherwise, it would be called a, breast thing and a tummy thing. So a mummy makeover by the name is a breast op and a tummy op. It wouldn't be carried out in one go at the moment because we're not allowed to do big ops. But under normal circumstances, yes, it would be carried out in one go. And the healing time is dressings on for a week or two. After a couple of weeks, you'll be active. So maybe driving, maybe 3. If a mummy makeover is quite a lot because it's a tummy and a breast, so maybe 3 weeks for driving, and then just short distances and getting back into stuff, and then probably 6 to 8 weeks. So probably a couple of months before you're doing anything lifting and things. So if you're working a job, normally say like 3 weeks off, 3 weeks light duties, or 3 weeks off, 3 weeks phased return, something like that. And then after 6 weeks, you'll feel like getting back into it. But the scars will be red. You'll have funny feelings, both in your breast and your tummy, funny sensations. It takes a few months for things to really settle. Oh, what's going on here? How long is it? I think it's just a bit further. Ooh, I've got another one. At what point can I start walking on the treadmill after the tummy tuck? Thanks, JJ. I would say, Olivia, you can start walking on the treadmill, walking, mind, not running, after 2 weeks. If you feel up to it. Listen to your body, and if you feel up to it, then you can start walking on the treadmill after a couple of weeks, gently. And then if it's okay, then just carry on. I think walking is good. Running's a bit different because it's the impact that's going to hurt, so that's going to be a couple of months. But yeah, after a couple of weeks, I think you'd be able to walk on your treadmill, Olivia. Can you explain why my tattoo is not suitable to remove? Now, with the tattoo ones, I've asked people if I can show them their photo, but there's no evidence to say this person's allowed me to show their photo. It's 4 inches wide and 2.5 inches long on the top of my arm shoulder. I think I know this one. This is, this is a tattoo. Yeah. So the shoulder's just a bad area. We get quite a lot of ones on the shoulder, and it's just a bad area for a scar. There's a risk of lumpy scarring, keloid scarring, ugly scarring. And not only that, there's not a huge amount of spare skin. The skin's really tight, on the abdomen, maybe on the back, there's a bit of laxity, but the shoulder, there's no laxity. It's really tight. So you can only get a little bit out of a time. So you can probably get about that much out of a time. So if your tattoo is bigger than that, if your tattoo is like that, that's 3 goes, at least. And it's a risk of an ugly scarring. And the problem is, if you've got a tattoo that you don't like, if you get an ugly scar, you might have an ugly scar that you don't like. So what's the point, sort of thing? Unless there's some kind of psychological element. Sometimes people have got a psychological element to the tattoo and they say, I don't care, I want it removed. you can sort of understand that. But if you want it for cosmetic reasons because you don't like the look of the tattoo, I'm saying, well, you've got to be really careful, because if you get an ugly scar, you might have just traded one thing you don't like the look of for another thing you don't like the look of, and paid, hundreds of thousands of pounds for the privilege. So you've got to be careful. Yoga, yes, yoga. I don't really know what yoga involves, Olivia, but if it's gentle stretching and things, gently at 2 weeks, gently you can start getting back into things, as long as it's not too strenuous and you're not putting power through your abdomen. Do you know if a sick note I think that is, not a sick knot, can be given post? Yes, I do know, Emma, and it can. And we have to write something on it, so we tend to write surgery on it. So yes, definitely, we can give you a sick note, and we write surgery on it. That's absolutely fine. What is a typical timeline for breast reduction surgery recovery? I've got to be honest with you, Leonie. This is like the magician unmasking. You know that one? Have you seen the masked magician who tells you how all the tricks are done? Most are the same. I've got to be honest. Full disclosure. Couple of weeks to healing. So breast reduction, same. 2 or 3 weeks for driving. Walking, gentle exercise after 2 weeks. Heavy exercise 6 weeks. They're all pretty similar, to be honest. Maybe a bit less for breast augmentation, because that's like less scarring. But yeah. Telling you all my secrets now. You're going to do your own Q&A, aren't you? Huh? It's really easy answering these questions. Just have a thing of answers. 2 weeks walking, 6 weeks exercise. Done that. Can you explain? I've done that. I've been told I should try to stop smoking before surgery. Does this apply to vaping products as well? Yes. Vaping is also bad. It's not as bad as smoking, but there's nicotine. Well, if there's nicotine in it, I have reason to believe you can do vaping with water. Can you? Well, it's just water, but I think most of them have got nicotine in them, and nicotine is bad for to make the blood vessels clamp down. So it's not as bad as smoking. So that's good, but it is not good, and it depends on the surgery. So some kind of body contouring surgery, like a breast reduction, mastopexy, tummy tuck, facelift, arm reduction, thigh lift, all of these are closed under tension. So anything that affects the wound healing is a disaster. So smoking is something that affects the wound healing. So if you want to have one of those surgeries, and I normally say, if you can't stop smoking, don't have the surgery, because it is bad news. Simple as that. Is there more one type of liposuction? So can you explain the difference? Yeah, there's loads. So the difference is, liposuction started off with a metal tube you stick in and you suck the fat out. And it started off, well, Tulip was here earlier, wasn't it? You got a Tulip system, which was a syringe, like a big 50ml syringe, and you put the syringe on, and that gives you negative pressure, and you can still do it that way. And that's a good way to do liposuction, to be honest with you. It's a very adequate way to do liposuction. You basically negative pressure on a syringe, metal tube, suck the fat out. And then so that's, to be honest with you, that's the basic premise of all of them. And what the different types are variations on a theme. And if you see someone who's had liposuction, arguably it will be hard to tell what type of liposuction you've had. You can't tell the difference by the results. Now, the people who make the machines that do the different types do say they give different things. But so what I do that one, the suck out. Don't use it very often, that manual one. So that's so then the next step up is a machine that sucks rather than the syringe. So they're both suction assisted liposuction, SAL. So suction assisted liposuction is the sort of basic, I guess. Then you've got power assisted liposuction. So it's a machine called a micro air, and the cannula automatically goes backwards and forwards, as well as connected to suction. So when your hand's going backwards and forwards, the cannula is going backwards and forwards. So it just makes it a bit easier. And so that's what I tend to use, power assisted liposuction. The other types of liposuction deliver energy to the fat in some way. So there's VASA, which delivers ultrasound energy. There's you can deliver laser. There's laser liposuction, where you deliver laser energy, things like smart lipo. There's things like radio frequency. So there's ways of delivering energy to the fat before you suck it out. And the benefit of that is that because you're sort of emulsifying the fat or liquefying the fat a bit, you can use a smaller cannula. So they're often done under a local anesthetic, whereas power assisted, the one that I do, is usually done under a general anesthetic. So use a smaller cannula. You can often do it under local anesthetic. And the other benefit is they say that the energy causes some degree of skin retraction, which is a big deal when you're talking about the central abdomen, because I don't think power assisted liposuction is very good for the central abdomen because it doesn't cause a significant degree of skin retraction. Now, whether these assisted ones form enough skin retraction to be a good option for the abdomen, I don't know. You'd have to talk to someone who does it, but that is the the nubbins of the different types. They're usually some kind of energy to deliver to the fat, but you've got to be careful because the energy can heat up because it obviously has to destroy the fat, and that can damage the skin. That is one of the worries. You can get problems with paresthesia and worst case burns, but I think they've got it sussed now with temperature monitoring and stuff, so that's less of an issue. Olivia's going to Cyprus on Thursday for a tummy tuck. I've got quarantine for 7 days. The surgery's 14th, 15th of August. That is exciting, Olivia. That is very exciting. Wow, Cyprus for a tummy tuck. Good luck with that, Olivia. Good luck with that. That is, yeah, I hope that's, what's the weather like in Cyprus? A bit of a break over in Cyprus. Where are we up to? Sorry. Is this, oh no, God. More one type of live person. Considering a lip lift, but wondering how much scarring there will be. So a lip lift, yeah. So I don't do this sort of thing, full disclosure. But I can tell you in general terms. And so obviously the common, is it obvious? Maybe it's not. Maybe it's not obvious. But the common thing with lips is a lip filler. So injection of lip filler into the lip to plump up the lip. A lip lift is a slightly different thing. So a lip lift involves, maybe I haven't demonstrated it very well. Is that demonstrated it? Does that make, do I look better? Hello, my name's Jonathan. I've just had my lips done. So this is what a lip lift does. So lifts your lip. That versus that. Hello. How are you? I've got 1 minute 58 remaining on Instagram. So this is a lip lift, and the good thing about a lip lift is that it's permanent because it involves actually lifting the lip. And one of the things as plastic surgeons, we try and hide scars. So like I was saying earlier about they want to leave scars, and it gives a scar at the base of the nose there. So we try and hide them in natural shadows. So there's a natural shadow at the base of your areola here. So you hide the scar up there, and it lifts the lip like that. I thought, could get used to that actually. It looks quite good. How do I look? Do I look good? So anyway, that's what a lip lift does. And what's the question? How much scarring there'll be? Yeah, there is scarring, and it is quite a long scar, but we try and hide it up at the base of your nose so that it's not too obvious once it's settled. But it might be a bit obvious to start off with under here stuff. But I don't do it, so better talk to someone who does it and look at some photos. That's what I would do. But yeah, that is a thing, and as I say, it's permanent as opposed to a filler, which tends to be temporary. So whilst wearing a low top at the weekend, we're on a countdown on Instagram, 45 seconds. I'm going to go off and come back. So don't worry, guys. I can see that you're worried that you're going to lose me. Don't worry. I'll be back. Whilst wearing a low top at the weekend, the end of my scar from breast surgery has caught the sun and has raised up. Can I do anything to make this go flat again, please? Low top, the end of my scar has caught the sun and raised up. I don't know what raised up means. So you've got to be a bit careful if you caught the sun because you don't want to get a tan on your scar. Because if it's an active scar, abs, I'm going to leave in a minute because I've only got 10 seconds left on Instagram. I've only got an hour limit. So I'm going to leave. I'm going to get cut off, but I'm going to come back. So don't panic because I could see you panicking there. Oh, it's ended. That's not the picture, is it? Oh, that's the picture. Am I in the middle of a question? Oh yeah, the scar. So they don't normally go. What does it say? Go raised. Yeah, raised is unusual. Um, but if it's a bit red, I would just say, if you've literally got sunburn on it, is that, things like aloe vera can help. Aloe vera cream can help with the sunburn. Um, but if if you've got a tan on it, which doesn't sound like what you're describing, then there's not a lot you can do except for cutting it out and redoing the scar. Um, look at this multitasking. I can't multitask, can I? Um, so if it's if it's raised up and red, that sounds like might be a hypertrophic scar. Now that won't be caused by the sun, but if it's red and raised, there are things you can do like silicone gel, silicone sheets, massage. Oh, massage is probably the easiest thing in the first instance, and I would say get your surgeon to have a look at it, or send them a photo. And massage, silicone, and steroid injections can help if it's a hypertrophic scar, but it doesn't necessarily sound um, like a hypertrophic scar. It sounds like it's just red in the sun. I'm back, Instagram. Nice to be back. Yeah, no one's there now. Anyone at Facebook? Is everyone left? Have I gone on too long? I started late. Everyone's gone to bed. What am I doing? What am I doing in my life? Oh God. Right. Anyway, I'm going to put. Oh, is this the last question? Was the last question anyway? Hold on. They're telling my followers to join the video. Don't worry, Instagram. Don't bother telling them. It's okay. I'm on my last question. You can if you want, but anyway. Oh God, there's some. What's happened? Hold on a minute. Nice and hot there. Oh, that's Cyprus, is it? Yeah. Olivia, what's that? Emojis, right? Okay. Crying. Left a ridge. Left a ridge. Leonie, is there a certain BMI you must have for surgery? Yeah, when you have surgery, the normal BMI that people talk. Leonie, is that the same Leonie? You and both? Oh, double. When you have a surgery, the normal BMI we talk about is 30. So if someone asks what's the BMI, I'd say 30. But having said that, particularly people who've lost a lot of weight can often have a BMI above 30 and might not want to be below 30. And similarly, people might be below 30 and might want to lose weight. So the thing that I say that's more important is you're stable and comfortable with your weight. Obviously, if your weight's high, 35, if your BMI is 35, you'd be thinking you got a higher risk of complications. So you might be thinking you're going to get a better result if you can get it down. But if it's like 31, you're like, well, you probably have got a higher risk of complications. You probably are going to get a better result if you can get your weight down. But you might say, I don't want to get my weight down. My face looks gone. I'm not happy. I don't want to get it weight down. So, well, okay. So as I say, it's really more important that you're stable and comfortable with your weight. But if you want a number, 30 is the one that we normally work on. 12 months post-op and scar wasn't raised previously. Oh, left the ridge. Oh, was that the scar? Okay. Yeah. I don't know. Can't. A ridge. So was it your bra strap or something causing a ridge? I can't read to the sun. What was the thing again? Was it the sun? What was the? Caught the sun. Yeah, it's unusual for it to be raised up for it's caught the sun. I go with massage, Calm, to start off with. Bit of massage that might help. That's sort of the simplest thing with the least complications, really, and see how it goes. And if it is sunburn, then a bit of aloe vera or after sun or something might help. Where are you based, please? I am based in Edgbaston in Birmingham, Kelly, close to the city centre. And Tracy Finch is here. Hi, Tracy. Good to see you. Hope to get things sorted soon, Tracy. Hope. We saw went to one of the hospitals today, so hoping to get some dates in the diary soon, Tracy. Yesby moved to FB from Insta, moved to Facebook from Insta. My BMI is 30. Exactly. Well, there you go. Spot on. But the main thing really, Leonie, is if you're comfortable with your weight. So if you're comfortable with your weight, then fine. But if you're not, then you're better off, losing weight if you do want to lose weight, because you're going to get a better result. You don't want to have significant weight fluctuations after surgery, basically. Because if you lose weight after surgery, I don't know what surgery you were thinking of having, but whatever it is, tightening the skin, whether it be your thighs, your tummy, your breasts, whatever, if you lose weight, you might have a bit of black skin after surgery. Jackie, thank you for all the interesting info. Jackie, thank you for you're here, Jackie. I'm glad that someone's. Thank you. I know that I shouldn't say just Jackie, because I know that I've got a loyal army of followers, obviously. But thank you for all the interest. Do you still sell scars? Yes, we do, Jackie. Yes, we do. Of course we do. What you're saying, Jackie, is it hard to find on the website? You're saying the navigation of the website's a bit funny. Before the lockdown, we were going to get the website redone. We'll get back onto that. I'll give you the link. I'm going to put it in the chat. Has that worked? That's the scar. Yes, we do. You can get it on. You can either come and pick it up, or you can post it out to you. Wait, have I posted it twice? Oh, Facebook and YouTube. Oh. So we do sell. So we sell the scar gel. We sell the scar gel with the rollerball, the massaging one, and we sell moisturizing, the QV cream, the moisturizing cream. So yes, we do. Good old Tracy. Kelly, my BMI is 31 and I've had some coats on a mummy makeover and no one would accept me till my BMI is 29. Bit harsh. I mean, if you can get your BMI to 29, I think it'd be better. But we don't have a thing that says it has to be this or that. Personally, I would say if you want to lose weight, you should lose weight first. And I think there's no harm in saying to you, you're better off losing weight. The problem comes, particularly as I say, if we get some people who've had a BMI of 45, and then go to 32, and you feel a bit bad saying, it's got to get it down to 30. Plus nothing magic happens at 30. It's not like 31 to 29. It's going to be better. There's no question about it. But there's not going to, you can still get complications at 29, and you might get nothing at 31. So it's not written in stone. But yeah, I think the general principle of getting it down would be a good thing. Leonie, it was a breast reduction. Thank you for answering all my questions. Thank you for asking them, Leonie. I was on my own. Well, I thought I was on my own to start with. I maybe wasn't on my own, but I felt I was. Jackie's making up the numbers by coming on both. That's what we like to see. Yeah, we'll check the site. Thank you. I've got to say, Jackie, you can also get it on in Boots and other leading chemists. So you don't have to get it from our website. You're welcome to get it from our website if you want, but it's basically silicone. The one with the rollerballs, I'm not so sure. I haven't seen the one with the rollerballs in the shops. Maybe it is there. Maybe I'll get in trouble for saying that, but I haven't seen it. But to be fair, I haven't really looked, actually, having said that. So maybe it is in the shops. But the rollerball ones, I think, is really good. What we got here? Last question. I'm a G cup and I want an uplift. I still want to be a big cup size. Can this be achieved without implants? Yeah, of course. What? Can this be achieved without implants? So implants will make your cup bigger. This is what we were saying at the beginning, wasn't it? Is that the same person who said about the lift? What were they saying? Something about breast reduction and implants. So let's get this straight. Implants are really good at making your breasts bigger. So if you want your breasts smaller, you don't want implants. So if you're a G cup, unless you want to be bigger than a G, but I'm assuming you don't want to be bigger than a G, do you? Crikey. The problem is, so you want an uplift. The problem with being a G cup and wanting an uplift and you don't want to be smaller, it's okay. You can do an uplift if you're a G cup, but the problem is your weight of your breast is so heavy, it will be acted on by gravity and it will droop again. So it would be better from a purely surgical point of view to have a reduction, not implants, to have a reduction to take some volume out, so it's less likely to droop again, but the breast will be smaller. So it's no good doing that if you're saying, "Oh, still want to be big cup size." So there's a conversation to be had there as to whether you want to keep your cup size, because at the end of the day, we want to make you happy. We don't want to reduce your breasts and say that's better for you because they're not likely to droop if you don't want smaller breasts. So if you want the breast to be the same size, then you could have just a lift. But at a G cup, you would be better off, and you're going to get a more long-lasting result if you have a reduction, take some volume away, take some heaviness away, and then it's less likely to droop over time. But a reduction is a bigger operation, more risk of complications, etc. So, it's a difficult. Kelly, how do I receive a quote, please, by email? ? Kelly, you can go on the website and you can say request a quote, and it will send you a quote. Or you can say here, yes, by email, we need your email. So you can message me, you can private message me and ask for a quote, and we can send it out to you. Or you can give us a ring. Or you can email me, info@staianoplasticsurgery.co.uk. All these ways of getting a quote, Kelly. And then after Kelly, we've got Kerry. How long after breast surgery until I could have a revision? Oh my God, that doesn't sound good, Kerry. It's not a good way to go into things. Well, the answer is it depends on what the problem is. So I would say minimum 3 months. You want to wait things to settle, minimum. But it depends on what the problem is. So if it's a way off problem and it looks terrible and you just know nothing's going to make it better, then you want to wait for the scar to. Ideally, you don't really want to operate on someone within those first 3 months. It's horrible going back and operating on people in the first 3 months. The tissues are woody, edematous. It's just not nice doing the surgery. So you want to wait a minimum of 3 months till those scars settle. And I know it sounds weird that you want your scars to soften and settle, and then you cut them open again. You think, what? But it's really horrible operating when the scars are still fresh. So you want to wait at least 3 months for everything to soften and settle, and that makes the tissues easier to handle. But I can tell you now, Kerry, things settle significantly in the first year, and you'd be surprised. So I would be inclined to try and keep people as long as possible, really. There's a balance between if your patient's going to be unhappy and you're going to make them happy by doing a revision, you want to make them happy as soon as possible. So that would make you want to do the revision early. But a lot of things will settle and they might not need a revision, or at least need less of a revision. So that would make you want to do the revision late. So I would ideally want to wait around a year, ideally from a surgical point of view, to get things to really properly settle. And then depending on how it's looking, if it's looking like a little bit better, you might say, well, should we leave it a bit longer because it might continue to settle for years to come. But as I say, if it's way off and you think this is no way this is going to settle, you might want to maybe consider doing something a bit earlier. But I would say 3 months to 12 months would be your period of time is where you'd want to wait, depending on how bad the problem is and depending on whether it's getting better. Be true to yourself. If it is getting a bit better, because sometimes people think, I've got to get this revision, I've got to make my point. But in your heart, if it really is getting a bit better, let's let it go as good as it's going to get, because as I say, you might need less of a revision or maybe even no revision at all. It's not uncommon for people to say, hold on a minute, this one's bigger than that one, and this nipple's here, and this scar's that, and this is, and then you see them at 6 months, 7 months, you're like, oh, actually, yeah, what was that one bigger? And it all settles down. Kelly, brilliant, Kelly. Thank you, Kerry. Thank you. I'm out. I've done all my questions. That was a good haul tonight. Thank you all for those lovely questions. And I am... Oh, here we go. Nipple loss. Say no more. Oh. Were you... Don't tell me we've had 2 nipple loss people tonight, will we? Oh, God. This makes me feel a bit... So, Kerry, well, that's a bit different, Kerry. I mean, that's not a revision. I'm assuming you've been... Yeah. Well, nipple loss is a complication, is a sort of an acute complication that would need to be dealt with. But then once it's dealt with and the skin's healed, then yeah, you if you're going to look at a nipple reconstruction, like I was saying earlier, was I saying to you earlier? Was it on anyway? I would say a year for that to get those tissues to soften, because you have to. Was I talking to you earlier about the scar, the nipple reconstruction on a scar? It's hard to do nipple reconstruction on a scar. So yeah, I wait at least a year before considering a reconstruction. So I'm really sorry to hear that, Kerry, and rare complication. Have we had it twice tonight, or is it the same one? Night, Olivia. Good night and good luck in Cyprus, was it? Yeah. And yeah, good night, everybody. Thank you all. And if you've got any questions, please ask away. Message me. Good night, Jackie. Message me or email me, or well, that's probably the main ones, isn't it? Wendy, bye, Wendy. See you soon. Or do whatever. Must have been someone else. I've had a skin graft. My God, Kerry, really? It was. Were you here earlier, Kerry? Someone else was talking about this on Instagram. It was on the other Instagram. Anyway, wow, that's wow. So yeah, you want that skin graft to properly settle before doing anything. And I've got to be honest with you, Kerry, on a skin graft, my best advice would be to think about a tattoo, 3-dimensional tattoo, because creating a nipple on a skin graft would be really tough. But that's my advice. But as I was saying to the person earlier, look for a breast reconstruction surgeon, because they're used to doing nipple reconstructions. So in plastic surgery, there's different types of surgeons, different types of specialists. So the problem in a way is that in the private sector, everybody does everything, which isn't as bad as it sounds, because I think most surgeons will be trained to do sort of, breast implants and things. But we've all got a subspecialty. So there's a subspecialty of hand surgery, burn surgery, skin cancer, head and neck cancer, breast cancer, craniofacial, cleft lip, pediatric. So each plastic surgeon will have a subspecialty in one of those. So I look for a breast reconstruction surgeon for that, because that's a tricky case. Kerry. Sorry to hear that. So have a good evening, everybody. Hope to see you soon too, Tracy, and I hope to give you some news soon. Kerry, thank you. Good luck with everything, Kerry, and good night. And I'm gonna check myself out, Dali Borek. I'm gonna check myself out. Thank you for visiting, and I will see you again, same time, same place, 7:00. Remember, don't be late like tonight. 7:30. What are you playing at? Come on.